medical professionals take an oath to preserve human dignity, respect patient autonomy, and provide competent, compassionate care. So, when a loved one suffers from a terrible disease, your first instinct is to get them to a hospital, trusting that they will receive the best possible treatment. You put their life in the hands of professionals who have sworn to protect it. But what if the very people meant to heal them are the ones who take their lives? This is the story of Niels Högel, the German nurse who betrayed that trust.
Well, here in Germany, a court has sentenced one of the world's most prolific serial killers to life in prison. Former hospital nurse Niels Högel has been found guilty of killing 85 patients in his care. Prosecutors said that he deliberately induced cardiac arrest in patients so that he could then resuscitate them and impress his colleagues,
ending the lives of over 100 patients. On December 30th, 1976, Niels Högel was born in Wilhelmshaven, Germany. As a child, Niels' parents did their best to give him and his older sister a good childhood. They were often indoors and well protected from violence and the harsh reality of the outside world. Moreover, his parents had professions that involved being truthful and helping others, so he had them as good examples and good role models to follow. His father worked as a nurse in St. Willehad Hospital, and his mother was a paralegal. This line of noble professions ran from generations, as his grandmother was also a nurse and was a role model for Niels. So, growing up to witness his father and grandmother's lives as a nurse, Niels also decided to pursue a career in the nursing profession. Unlike in many countries at the time, nursing was perceived as a vocational career. So, instead of going to college for a few years, Niels attended and completed his vocational training at St. Willehad Hospital, the same place his father worked in 1997. In the same year, he became a nurse and continued working there for 2 more years before getting a job at the Oldenburg Clinic in 1999. At Oldenburg Clinic, Niels started well and was placed in the cardiac surgery intensive care unit, Ward 211. There, he monitored patients, administered medication, and helped in emergencies. However, colleagues soon noticed a disturbing increase in the number of deaths between 1999 and 2001. To figure out what was wrong, the doctors and nursing assistants held a meeting to discuss the sudden increase in not only the death rate, but also resuscitation in the past few years. At the meeting, it was discovered that 58% of these deaths occurred while Niels was on duty. Not long after the meeting, Niels called in sick for 3 weeks and didn't show up for work. During this time, only 2 patients in Ward 211 had died, and that was where the suspicion began. One would think the suspicion would lead them to investigate him, but instead, they provided a temporary solution to the situation. In 2001, under pressure from the head physician at Ward 211, Niels was transferred to the anesthesiology ward. Soon, his colleagues at his new station started becoming suspicious of him. It was highly questionable that even in emergencies not assigned to him, Niels would try to include himself and was often present during resuscitation. In September 2002, the head doctor at Oldenburg Clinic questioned Niels after several of his patients were found in critical condition for no apparent reason. Then, he was given 2 options: either resign from his position and continue to get paid for the next 3 months, or transfer to the logistics units, where he would only have to move patients around. Niels chose the former. In December 2002, a reference letter from Oldenburg Clinic's director of nursing testified to Niels's circumspect, diligent, and autonomous work ethic, and his having acted prudently and in an objectively correct manner in critical situations. With this, Niels began working at the Delmenhorst Clinic. Initially at Delmenhorst Clinic, Niels was seen as a hero and a highly competent nurse. As his usual practice in his former workplace, he was always present in emergencies and often resuscitated many patients back to life. In fact, his colleagues called him Resuscitation Rambo and gifted him a necklace made of injection tubes which he wore with great pride. However, as time passed, his co-workers started noticing a worrisome pattern. When Niels was on duty, the rate of emergencies often spiked due to a sudden decrease in blood pressure and irregular heartbeat called arrhythmia. Instead of taking action, not wanting to be involved in whatever dark cloud was hovering over him, colleagues started distancing themselves from him. Even when 4 empty vials of adrenaline, a medication used to control the heartbeat, were found in the trash can in Niels' ward, despite no doctor having prescribed them at that time, his superiors did nothing about it. By this time, you might have guessed who Niels is or still be wondering. Either way, I will let you in. In a twisted way of thinking, Niels Högel sees himself as a heroic figure and likes to milk every opportunity he gets to play the hero, and if the opportunities don't come his way, he makes ones for himself. That is why he inserts himself into emergencies to be a heroic nurse. When it seems like these patients are making a full recovery, he injects them with dangerous doses of drugs such as adrenaline, lidocaine, sotalol, amiodarone, and other medications that could cause irregular heartbeats, circulatory collapse, or cardiac arrest. Once the patient went into crisis, he would attempt heroic resuscitation efforts to revive them in front of colleagues. In many of these cases, his resuscitation was successful, but a lot more resulted in deaths. And if a patient survived the attack with the first medication, Niels will administer another one so that he can perform resuscitation in front of his colleagues and be called the hero. After he got married in 2004, his wife gave birth to their daughter. Of course, he was excited to welcome her into the world, so much so that on his first night on duty after her birth, he injected a severely ill patient with a toxic agent to sustain his feeling of euphoria. That was how twisted his mind was. All he wanted was attention at any cost. Eventually, on June 22, 2005, Niels Högel was caught standing over a patient and intentionally manipulating their syringe pump so he could inappropriately administer high doses of adrenaline. Further investigations were carried out, and in the summer of 2005, he was arrested and subjected to court trials that will reveal even more shocking truths and cement Niels Högel's reputation as one of the most notorious serial killers in modern history. This discovery prompted the police to begin an investigation on Niels, and to the surprise of the police and the public at large, 73% of the deaths in Delmenhorst Clinic between 2003 and 2005 were during Niels Högel's shift. Then, colleagues started to voice out their years-long suspicions about Niels' involvement in unusual and unexplained deaths in their hospital. In December 2006, a German court sentenced Högel to 5 years in prison and banned him from working for the same period for attempted murder in the June 22, 2005 case. However, a plaintiff disagreed with the verdict and appealed. A higher court later overturned the decision, and in June 2008, Högel was sentenced to 7.5 years in prison and banned from working for life. However, as his 7-year prison sentence ended in January 2014, the Oldenburg District Attorney's Office reopened an investigation into Niels Högel's time at the Delmenhorst Clinic. Following proper investigations, Niels was charged with 3 counts of murder and 2 counts of attempted murder in September 2014. After confessing to these crimes, Niels said something that shocked the police and the public. He admitted that he had committed 30 additional murders and 60 successful resuscitations. On February 28, 2015, he was sentenced to life imprisonment. His new confession led the police to suspect that he might be responsible for more deaths than he was letting on. So, from November 2014 to 2017, a special commission named Cardio launched one of the largest medical crime investigations in German history. This investigation led them to visit 67 cemeteries to exhume and autopsy a total of 134 bodies across Germany, Poland, and Turkey. All they wanted to do was dig deeper into deaths that occurred during Niels' practice at his various places of employment. Unfortunately, some of these bodies were too decayed to be helpful for any tests, but the investigation went on for 3 years, and the cardio team evaluated more than 200 cases. At the end of the investigations in 2017, the police calculated the total number of victims attributed to Niels Högel to be 106, including 6 for which he had already been convicted. In January 2018, prosecutors in Oldenburg charged Högel with killing 100 patients between the ages of 34 and 96 years old from February 7, 2000 and June 24, 2005. Due to the public demand for justice, especially from the victims' families, and the severity of the crime, Högel still went to trial. His previous sentence could not be revised, as it was the maximum allowed in a German court. The trial became one of the largest in modern German history. Spanning 24 days, the trial was held in the Weser Ems Hallen ballrooms to accommodate the large number of people involved. 80 seats were reserved for the media, while 118 were set aside for the general public. Every day, attendance grew as more people gathered to witness the proceedings. Out of 100 murder charges, Högel admitted to 43, denied 5, and for the remaining 52, he claimed to have no memory but did not deny them. He delivered his statements with little to no emotion as the victims' families relived their pain, some finding closure. In contrast, others were left uncertain about whether Högel was responsible for their loved ones' deaths. Although German courts do not allow formal pleas, Högel expressed his regret and shame when the medical records of his former patients were read aloud. On June 6, 2019, Högel was convicted of 85 murders and sentenced to life in prison without parole. Although Niels Högel remains in prison, the family of his victims will never get closure and will forever wonder why someone they trusted with the lives of their loved ones would take them with no remorse. Please share your thoughts in the comments. Also, remember to like, share, subscribe, and turn on post notifications. See you in the next video.